Okay, so now we're going to go over how to protect yourself from disease transmission. And a lot of these diseases we're going to talk about, we're going to get into more detail with later in the program when we do the infectious disease chapter, when you're almost done. So, okay, so patients frequently come in contact with frequently have a communicable or infectious disease. And there's a difference. An infectious disease is a disease that is caused by an organism or a germ. And the germ is usually a bacteria or a virus. It could also be a fungus or a parasite. So communicable diseases are infectious diseases that can be spread from one person to another. And these can be spread primarily through four ways. There's indirect or direct contact. So direct contact would be a patient's blood coming in contact with an open sore on your skin, and you get an infection that way. That would be direct contact. Sexually transmitted diseases are also part of direct contact. An indirect contact would be if a patient got some blood on the stretcher, or there is a laryngoscope that's used to place help place a tube down the patient's throat. There were some secretions on that came in contact with an open sore on your skin. That would be indirect contact. So the germ was on a surface, you touched the surface, that made it into your body past your skin. Airborne transmission is primarily from respiratory secretions. Although with Ebola, there was some of the diarrhea from the Ebola could be particleized and go airborne, and it was thought that people could contract it that way. Primarily airborne. And the biggest airborne disease there's actually two. Tuberculosis is one, but even more, see more is the influenza. So during flu season, patients with airborne. And think about you're in the back of an ambulance in this enclosed space, and the patient's breathing, or they may even be breathing nebulized breathing treatment going, and then you can breathe in the particles from that nebulizer. Foodborne, this is actually a risk if you take food with you in the ambulance. Refrigeration slows down bacteria growth, and if you have food that should be refrigerated that's not, and it's sitting in the ambulance for a while, that bacteria could make you sick. And there's vector-borne. West Nile virus, these are transmitted through animals, and West Nile and Zika are the most common ones now. Not something that we can really control or protect ourselves against when we're with patients. So how do we protect ourselves? This has changed a lot. So when some of the older instructors here worked, paramedics didn't wear gloves, and now we wear gloves pretty much on every call. And we're going to expect you to wear gloves when you go see a patient in clinical. Another thing is, this personal protective equipment, or PPE. There's also immunizations. We require you to get immunizations before the program for mostly chickenpox, mumps, measles, rubella, and whooping cough. And when we get those, and those is not as much that we require them, it's that the clinical sites that you go on require them. The OSHA, the Occupational Safety and Health Administration, is what actually makes requirements for workplaces for protection from bloodborne pathogens. Hospitals also make you get a flu shot in order to do clinical there. And the thing is, you're not going to know who has these diseases until you're probably at a point where you can be exposed to them. So one of the things we're going to start by wearing is gloves, and this is something that people do already, but they don't generally take the other PPE precautions that are available. So one thing is washing your hands. So as soon as the call is over, it's best to wash your hands. The best way to do that is for 20 seconds. You can sing happy birthday to you. Hand washing is not available. There's hand sanitizer, but hand washing is better. The downside to hand washing is that it can cause your hands to crack, especially in the winter. So it's a good idea to have hand lotion too. So eye protection, this is important for both splashes from secretions, protect you from spitting, so the patient gets spit in your eye. During invasive airway procedures where there might be suction, you should wear a mask too. Masks are sort of with the flu now. Masks have gone more in style. We're seeing more paramedics wearing masks to protect from respiratory precautions. So if you're going to do an invasive airway procedure, you would want a mask and a face shield, because there's a risk of droplets and there's a risk of splashing. For patients with suspected tuberculosis, there's an N95 or an N100 respirator, and this is going to filter more air than the surgical mask will. And this is because tuberculosis is more contagious. Another thing we can do to protect ourselves from indirect contact is cleaning the ambulance. Anything that's going to come in contact with the patient, the bench seat rails, think about what you're touching, radio handles, pens. Now a lot of ambulances have tablets. So you want to disinfect them. Your cell phone, you want to sanitize that too. So we're going to go through what to do, how to do that. Well, there's sanitizing, and we can sanitize with like a Lysol wipe or a alcohol prep. Anything that's going to come in contact with your skin or the patient's skin, so stethoscopes should be sanitized. And then if there's anything with any reusable equipment, a lot of equipment's disposable now, but if there's anything that is reusable, such as a stethoscope or a blood pressure cuff that is contaminated, means there's the presence of a germ on it. First, we want to wash it away. We want to clean start by cleaning. So get rid of any blood or any other secretions that are on it. And then we're going to use a disinfecting agent. And this is going to be more potent. This is there's a number of hospital-grade disinfectants available, but the one is bleach mixed with water in a 1-to-10 ratio. So for every 1 ounce of bleach, you add 10 ounces or water. And these are going to kill the microorganisms on your equipment. So first we want to wash, and then we want to disinfect. And bleach can be harmful, and so the hospital-grade disinfectants can be harmful for your skin. So you want to use this with a new pair of gloves. Take off the pair of gloves that you were using to treat the patient, and put this on. Another thing to consider is disposal of sharps. So in the fall, we're going to start starting IVs, and we're going to be giving medications, and you're going to have exposed needles that came in contact with the patient. And one thing that's important is proper disposal of those sharps once they're used. Even if they don't come in contact with the patient, if they're just used to draw a medication and then administer it without the needle, then we still need to protect them. And that's a direct. A needle stick would be a direct exposure. And we'll go through more in the fall about how to dispose of needles. So if you do get exposed, if it's possible, you want to turn care over to another EMS provider, if you can. This isn't always possible, and it's not always necessary depending on what the type of exposure was. As soon as you're able to, even before you leave the scene, if you can wash the area with soap and water. If your eyes are exposed, if you're not wearing safety glasses, you need to flush your eyes for 20 minutes as soon as possible. And every department has to have an infection control plan, and there's a designated infection control officer. And these work with the OSHA requirements for workplace safety. And the infection control officer determines if an exposure occurred, and what they'll have. Each agency has to have a plan about what the follow-up is. That might be medical attention, it might be booster shots, it might be blood work, and then and follow-up care. So that is the management of prevention of infectious diseases. Thanks.